This is Duke University.
Well, I would like to say welcome. My name is Cindy Broderius. I am learning how to use this microphone. I am one of the counselors in the Career Center, and I have the privilege of working with a number of pre-health students. One of the questions that comes into my cubicle frequently with students is, I'm planning a gap year, and what types of experiences might I be able to plan for that experience? The next question that I hear most frequently is, what have other Duke students done for their gap year experience? So in collaboration with Dean P. over here and Ms. Wall from Health Professions Advising, we have been trying to put together some workshops to help students with that, answering those questions. And tonight's panel discussion, we have 5 awesome Duke alumni here that have come to share their stories of gap year experiences and to give some advice to those of you who are considering this option. The way that the evening is going to work tonight, we're going to give the microphone over to our panelists. They'll introduce themselves to give us an idea of what they did during their gap year experience and then offer a couple of things that they learned from that experience in terms of moving on to professional school, about themselves, about life in the real world and how that impacts their careers as healthcare professionals. And then we'll open the floor up to questions. So as you're listening to these individuals, be thinking about questions that you would like to ask specifically for your situation, or getting ideas about ways to think about exploring opportunities that you might like to craft into your gap year experience. Okay? Housekeeping details. If you haven't yet signed the registration sheet on the clipboard, there are 2 of them on either aisle. Please do that before you leave this evening. There's also a handout up there that has the pictures of our panelists and their email addresses. So they have graciously provided contact information for generating email dialogue and getting in touch with more specific questions. And I'm also going to use that registration sheet to create a listserv that will allow me to send the link for the video that we're recording this evening, and also give you an electronic copy of the handout too. So I am not going to introduce our friends other than to say this is Camille. Next to Camille is Colin, Anna, Lindsay, and Tassie. And I would like you to join me in giving them a warm welcome to this Gap Year Alumni panel discussion. All right, let's see.
Okay, so thank you very much for the introduction. Thanks for having us here tonight. So my name is Camille Ratliff. I graduated in 2010. I'm now a second-year medical student at Duke. So I took 2 years off for my gap year. And is the...
Oh yeah, they're just a little ringing.
Okay, put it further away. Better? Good, thanks. And so a little bit about what I did. I spent those 2 years, I spent half a year in Romania, half a year in Turkey, and 1 year in Boston. And with all of those, I was in diabetes clinics. And I call it my little diabetes world tour. I kind of the nitty-gritty of how it happened was I ended up volunteering in both Romania and Turkey, and then that led to a full-time position at the Joslin Diabetes Center in Boston as a study coordinator. I think it was incredibly useful to have 2 years. My big advice is, one, do it, take time off. It's very helpful to gain some perspective and gain some life skills. And I really appreciated having more than just 1 year. I feel like if you go straight from had I gone straight from college to just doing 1 year, then I graduate in May, and by June I'm already working on my applications again. So there's not much of a break. So for me, getting to have 2 years off is getting to have actually time away from the cycle of applications, and time that I got to establish myself as financially independent and learn a new language and really kind of get some professional skills. Those things sound mundane, but they're very important. When I think about my time on the wards this year, so being on the wards, it's a job. Your time's not your own. You're responsible. There's a hierarchy. And I feel like I am in a fortunate position to have worked in a full-time position before coming back to medical school, because I would hate for this to be my first time on the job. When your boss is changing every week or two, and you always have different responsibilities, and your expectations keep changing, that sounds like the most confusing first job ever. So in terms of learning kind of the basics of how to fit into a team environment and to fit into an organization, and it sounds simple, but it certainly, I certainly made a few mistakes along the way, and having that time where it wasn't on the wards was really helpful. Plus, getting to travel and see places was great. So I'm happy. I'll take a lot more questions, but in terms of my advice, that's my big thing.
Let me know if this sounds bad. Hi everyone, my name's Colin. I was a graduate of 2012. I took one gap year, and now I'm a first-year medical student. I majored in neuroscience when I was at Duke, and I didn't do any neuroscience stuff in my gap year, but I did do research, and kind of came to that like in a roundabout way. I actually thought about doing like a Teach for America or like City Year type program. And even got accepted to one of those programs, and had a few events in my life change, like personal circumstances that led me to want to stay in Durham. And so I ended up changing my plans midway through the year and kind of frantically looking at what opportunities were available. And that's how I met Cindy to talk about these sort of things. And actually, the way that I found my research position was through I think it was the biology major. It's listserv. They send out random things all the time. You probably get them already. But I joined all of the ones, even the ones for the other majors that I wasn't a part of, just to catch all those things. And I think I got really lucky because the researcher that I've met with is a guy named Chris Wood, who was just coming to Duke, and he needed a research technician, basically. And he had nobody in his lab. So basically, he was like a starting faculty member, and I got to work with him as his first hire for the entire year, which was awesome because I got basically more one-on-one time than like most graduate students get with their PIs. And I think that's the kind of thing that comes through those research listservs, because there are a lot of them are like up-and-coming professors that are starting their position at Duke, and they're looking for basically cheap labor to do their work. But they're in return for I say cheap, but compared to making no money, you're making a comfortable salary, and actually probably more than a lot of the more noble teaching jobs. So my research was in cancer biology, and I had really no experience with that before I got into it, so I wouldn't worry about applying for a research job, even if you didn't do that much at Duke. Because when I was at Duke, I did like one summer of like kind of moderate effort research, but I never did like the whole independent study through the whole year, like 10 hours a week or whatever, because I just couldn't balance that with class and like fun things as well. So I kind of pushed my research into my gap year time, which I think worked out well because you get to focus on it. Whereas as a student, your first obligation is your schoolwork, and then you have like research on the side, and you might get like maybe 10 hours a week if you're really working hard. And for my gap year, I could spend 50 hours a week or more if I wanted to, pretty easily. And it just really amplifies what you can get done. And I think I was fortunate with my lab that just having that much time available makes good things happen. So if research is something that you're interested in, I would say definitely look into it for a gap year. But there are a ton of options, and it sounds like if our other panelists are like Camille, there are a lot of things represented here. So I'm happy to take more questions if you have them.
So hi, I'm Anna. I'm a 2011 Pratt graduate. I think the only Pratt on the panel, so representing engineering. I majored in biomedical engineering and a chem minor. I was also interested in Spanish, didn't end up minoring in it, but had a lot of global health experiences over the summers. So I actually deferred matriculating into Duke Med and sort of applied to med schools at the same time that I applied to other one-year opportunities. I also considered TFA and City Year, but I was considering even like global health experiences, also research experiences, and so things sort of came together such that I did a year of research at the University of Cambridge in England, and ended up getting a master's degree there in oncology. And things sort of came together where I just sort of cast a wide net, was really looking into a lot of things, was applying to med school, but what really sort of helped me decide on, should I take a gap year, should I not, and sort of applying to everything at once and then deciding was, I was just, had a pretty tough last semester. I know senior, spring is supposed to be really easy, like, joke classes. I was overloading, had, 5 classes, but one of them I really wanted to do was like Spanish for health professions. It was one of the service learning courses here, and, loved it, and it was totally worth overloading for, but it was also a lot of work. I was coordinating this international project in Honduras, just had so much on my plate that and I was also going to Guatemala after graduating, and it would have meant I had to like leave that early to start med school, and I was just like, no, I'm not going to do that. And so I did take a year and do research, and that was really one of the best decisions, I've made. And it sort of worked out where I knew Cambridge was good for science, wasn't really sure who I'd work with. I applied to, sort of all of the big name scholarships. Actually didn't end up getting those, but through my lab ended up getting funding through Cancer Research UK, which sort of owned the research institute that I was part of, and that worked out really well. My lab was awesome. It was really close to Europe, so I got to travel, see all the art history stuff that I'd wanted to see from high school. Also, sort of as Camille was mentioning, it was a very sort of professional development type year where sort of being a team player, it is so important, and you really see that on the wards in medicine, where learning how to interact with others and set objectives and meet those. I mean, that's really all of what medicine is about, especially the really busy services where you're managing tons of patients. I'm on the internal medicine rotation right now, so it's very busy, and each of my patients has like 10 problems, follow up on all these things, and so just keeping all of that in order is challenging. And so having strategies, learning strategies to do that, I mean, you learn a lot of that through classes, but I think the research environment is somewhat different, and especially if you are considering Duke for med school, it has a big research focus. And so sort of having some good research experience under your belt, as Colin mentioned as well, it's challenging to do that in undergrad. And I did the Pratt Fellows program, which does have research opportunities and does have a summer experience in addition to the 10 hours per week independent study. But it's still nothing quite like being fully immersed in it, and that's really what you're focusing on. Cambridge also had a lot of sort of graduate enrichment programs that I got to learn a little bit more about, like coding and speed reading, and that's important for med school too. So various other little enrichment things. Also worked on my bicycle skills because everyone bikes there. So on the wrong side of the road though, so not helpful for coming back. But overall, really the best decision I made, and I think deferring was really helpful to that, and I think I mentioned that in the the sort of description in the handout there. But I think if you're thinking about maybe doing a gap year, you can consider applying to everything at once. Then you're just getting all these decisions in your senior year, and then what I had set up, I already knew I was going to med school, so that was awesome. And then I didn't have to think about that at all during my gap year. I could fully focus on research. And students that I met at Cambridge who were applying to PhD programs, they had to come back to the States, for 3 weeks and apply to that, and there was a lot of stress, and I was like, nope, don't have to do that. So so think about deferring if you're interested in that, and I'm happy to answer any other questions.
All right, let's hope this works. Okay, hi everyone. So my name's Lindsay. I am class of 2010. I majored in psychology with a minor in chemistry. And how I kind of came about my gap year was kind of unusual. I didn't really decide I was going to be pre-med until a little bit later. I was kind of juggling everything that I was interested in. Then because of this, I kind of took all of my coursework a little bit later in undergrad. And I originally really wanted to go abroad. That was something I was really interested in. I wanted to have the cultural experience, and I was also interested in Spanish. But I wasn't able to go my junior year because I was kind of catching up on all of my coursework for pre-med. So then I decided to defer my enrollment into the summer of my junior year, still under the intention of trying to rush through and get my applications out for going straight through. But then I got back from abroad and was just like, why rush it? I want to do it right. I want to do it once type of thing. So I decided to take a gap year at that point, and it was probably the best decision I've ever made. I can't speak enough how much I learned from my gap year and how much time I enjoyed being on a gap year. So what I did was, I'm originally from the area, and I decided that I wanted to stay here just because I had my family around and all my friends. So I was looking mostly for research opportunities, again, because it was something that I had not done in undergrad. So I kind of was looking on the Duke HR. I looked at the NIH program because they have one in Raleigh that I know a few of my friends worked out. But I actually had known someone who had worked in a research lab here called Carolina's Cord Blood Bank, which is where I actually worked for my gap year. So I decided to pursue that because I knew other people had done it and had really good experiences. So I worked there as a research technician for 1 year. It's technically considered a research opportunity, but you're more so doing like clinical, I don't know how to describe it. It's not quite research in that you're working in the lab doing like a clinical work, if that makes any sense. So my job was basically working and collecting the cord blood and then preserving it and then preserving it and what they use for transplantation and the PBMT unit. So it was a very valuable experience for me. It was, like everyone had said, it was a good group setting, working in the lab. Working with cord blood, it's something that has a short life. So we had 48 hours to get it processed. So it was kind of quick turnover. So I got used to working on my feet and working kind of in a teamwork atmosphere with everyone else there. Just to echo what everyone else has said, I think one of the most valuable experiences that I got from my gap year was learning how to work with people. That being said, you're not going to get along with everyone that you work with, or you're not going to have the same mentality as everyone that you're working with, and that's going to translate on the wards as well. So learning how to find some common ground and work with those people is also very valuable to learn. Also, while working in the cord blood bank, I was intern coordinator for the undergraduates that had worked there. So that had given me another perspective. Like, I was in charge of people. I was teaching them, training them on various things. So that gave me a different aspect of responsibility that I think is also very valuable. Again, looking further onto my career, being able to teach as a resident, teaching medical students and so on and so forth. So I think that was another aspect of how great the program was for me. Finally, kind of to echo what Camille said, was just learning to live on my own, have a job, have finances. I know medical school is not cheap, and people are not used to having to deal with their finances. So people come to medical school and they're on loans and they don't know how to handle, getting groceries, paying rent, and all that stuff like that. At Duke, you're fortunate because you are living on campus. You don't really have to deal with that. You have your Duke card, you flex, you swipe. You don't really realize how much money you're spending, but as soon as you get in the real world, you will realize how expensive it is. So I cannot speak to how much it was, helpful it was to have that year of experience of, taking care of myself. That's all I have to say, so I'll just pass it on. I'll take questions later.
Good evening. So my name is Tassie Rufai. I actually graduated from Duke undergrad in 2004, and I took several gap years off, and I'm actually a double Dukey. I graduated from Duke's physical therapy school in 2012. So I'm currently a physical therapist at the VA in Durham, just across from Duke Hospital. And after graduating in 2004, I was a psychology major. I was also pre-med then. And I knew I wanted to take some time off. I played sports when I was in undergrad, and so being a student and being an athlete, that was kind of a lot. And I knew I wanted to take some time off just to relax. I was exhausted, and I wanted to strengthen my application before I applied to med school. So I did a post-bac program up in Duquesne, in Pittsburgh, for a year. And then once I was done with that, I still wanted to take some time to figure out if med school was really the route that I wanted to go. So I moved back in with my parents, which was a challenge, to say the least. I moved back in with my parents in Maryland, And I was working this temp job in D.C., and it was at this refugee resettlement agency, Catholic Charities, the national office. And I just figured I'd be there just a few months just to save some money as I figured out what I wanted to do. And then I became curious in the work that was being done there. Again, working with the refugee resettlement agency, that's something that I probably wouldn't have considered or even thought about it. You know, refugees, why would you ever really think about that unless that world coincided with what you were dealing with? But there was an opportunity for me to work in the processing center there, helping refugees who were in the United States who wanted to petition for their family members to join them here in the U.S. And so I worked there for a few years, and I wasn't really sure how that would pair with me going to med school. But again, it was just something that I was interested in doing. And then also taking some time away, you get the opportunity to reconnect with family, reconnect with friends, and just realizing that you don't have to decide what you want to do with the rest of your life immediately. It's okay to think about it. It's okay to explore some of your other interests that do not necessarily coincide with your career goals. Along the way, I'd considered physical therapy, but I thought it was just because I was having doubts about if med school was what I wanted to do. And so I said, well, why not go and spend some time in a physical therapy setting to see if that's something that's actually interesting to me. And honestly, the first day I went there, I was like, this is definitely the route that I want to take. Not to say anything is wrong with going to med school or going that route, but just for me, having the opportunity to spend a lot of time with my patients, hands-on, one-on-one, being able to make a difference in their body, make a difference in their life, I thought that was a better career path for me. And so once I decided that, I said, well, I've been out of school for, at that point, it may have been 4 or 5 years, and I said, well, let me take some more classes because I've been out of school for a while. So I took some classes while I was working, and then I applied for PT school here at Duke, and then came back in 2009. And a lot of what has already been spoken to is when you're working, being able to be financially responsible, being able to communicate with other people on a team you might be working with on the job, but then also in the work that I was doing, just taking a step back and understanding the different perspectives and dealing with patients, you know, what's their background, and coming to you as a provider, as a doctor, or in any capacity they need to see someone. What things are they dealing with, and how is that affecting what they're going to allow you to do as their provider, or what they don't want you to do as their provider? So I think no matter if you decide to take a gap year, no matter what job you take, I think it's important for you to understand that everyone's different. Everyone has different experiences, and the more you can relate to, the more you can understand where they're coming from, then that's going to serve you in being able to provide the best possible care to whatever population you might be dealing with.
Let me try this again. Now we'll open it up to questions. Feel free to ask a question. I will try to repeat that, and we'll have one or more of the panelists take a stab at answering that. So who'd like to be the first to ask a question? Yes?
I just have a quick question for Anna. So did you pursue an MPhil at the University of Cambridge, a master's in? Okay.
This is a question for Anna about the type of degree she pursued in Oxford, Cambridge.
And the time that it took, I guess, because I know that it's a year commitment, but I didn't know at what time you began and what time you ended.
Okay, yeah, so I'll address the degree I pursued and the timeline. Just because the UK system, sort of as you're hinting at, is actually on a different system. They have, sort of these terms like Michaelmas term, which is for fall, very quaint, like England. But anyway, so the timeline, I know for like Michaelmas, it traditionally starts in October, and then goes through, so a 12-month program would go through that full year. However, med school, of course, starts beginning of August, and so that is like a disconnect when you first think about that. Luckily for me, so like I mentioned, I went to Guatemala after graduating. That was a month-long experience in July, and then I was in contact with my lab. They let me start early, about a month early, and so I started, I think it was September, maybe sort of end of August time frame. I had like 3 weeks at home after Guatemala. So I started early at the lab, and that time counted, towards my, and I did pursue an MPhil degree, so a Master of Philosophy in Medical Sciences, Oncology, just I call it Masters in Oncology here. But so it was the MPhil, and it was a research-based MPhil. There are other MPhil options at Cambridge and Oxford and like other schools. Some of the friends that I had at Cambridge did class-based MPhils. Those might be a little harder to get the timeline to work out, but I was fortunate in being able to start early. It was lab-specific, and I could coordinate getting there early with my lab. And then I finished. I actually did just about 11 months, but still finished up. And actually, as Camille knows, I defended my thesis by Skype, and it's called a viva, but you defend your thesis. So I submitted my thesis, moved back, had enough time to move back to Duke and start, and then defended my thesis about 5 weeks later via Skype. So, but I had sort of tied everything up before I left, just had to defend it. But that was the timeline.
There's another question back here.
Hi, I guess this question can be for anyone, but I think I want to address it particularly to Camille, just because you have a little bit of a major that's like not really in the sciences, and I'm sort of kind of in the same boat, and I want to do global health and Spanish, and I told my parents, they're like, yeah, that's great, but if med school doesn't work out, what are you going to do with that? So I don't know, I just wanted to see if you could speak to that, and I'm worried about being marketable, or I don't know, what can I do as a job, like for a gap year if I don't have practical skills or whatever else they say.
The question is directed to Camille. For a non-science major, how does that translate into gap year opportunities?
So, great question. I'm happy to stick up for us non-science majors. So, international comparative studies, which is great in terms of leaving me the flexibility to complete all of my pre-med course while I was at Duke. And I had considered studying abroad while, certainly international comparative studies really is a major designed to help you study abroad. But instead, I filled that with my pre-med courses so I wouldn't have to do a post-bac program, and so I could use my time. And I did spend a year in Turkey and Romania afterwards. Kind of in terms of your question of specific opportunities, I think you can get skills from a lot of different things. So I had 2 very different years. The one spent in Eastern Europe and the one spent in Boston. The one in Boston was an official job. I was salaried. I was in charge of a study. I had PIs. The first year, I was a little feral, to be quite honest. In full disclosure, there's sort of 2 stories I tell. There's the story that I tell to my medical school interviews, and that's, I worked in Romania, in Cluj, at the Diabetes Center of Cluj, and then I helped do grant proposals, and I helped do research for the clinic, and I got to shadow and participate in grand rounds and do presentations. In Turkey, I got to work at the American Hospital in Istanbul in the endocrinology department. Also worked a lot with presentations, helped prepare research, got to present a poster at a conference. So, sounds good for the parents. Yeah. The other story is I was having a lot of fun, and I was bootstrapping my way. I had originally applied for a Fulbright to do diabetes research in Turkey. I'd made the finalist round of a Fulbright. I thought my project was perfect, and no one could tell me no. And it wasn't until the end of April that I got the letter that of the 20 finalists, only 10 got funding, and I wasn't one of those. And so at that point, we're like a couple weeks away from graduation. So I decided, well, I still know people in Turkey, so I'm still going to try and make it happen. Fortunately, and this is, I think, the bizarre piece that helped everything fall into place, is my father's a professor in another state, and he had gotten a Fulbright, just so happens, to Romania. So that's how I ended up in Romania and Turkey. I had my research contacts from Turkey that I could still continue to work for. Moving in with the rent sounded a lot more appealing when it was going to be in Romania. And I also, the same mentor that had helped put me in touch with people in Romania also knew someone in Romania. Put me in touch with people in Turkey, also knew someone in Romania. So that's how I was able to cobble that together. Finances-wise, I did translation work on the side to help pay my way. Cost of living in Eastern Europe is very cheap, and I also had places to live. So I know I'm going on a bit long about that, but it's kind of to say, in terms of if you're concerned about what people might think and what sort of skills you'll be gaining, I think being independent and getting to make your decisions, and for me, having to be put in a place and kind of, this is what I make of it, and I have to be very independent and really seek out what I'm going to do in a clinic and how I'm going to get something out of it. That was an incredible learning experience, and that was in a very unstructured environment. It could have been a very good experience or a very bad experience. And then I think just in terms of the security of the story that you tell, you can choose to tell things highlighting kind of the structure and the successes, but then it's always nice to hear that not everything comes together so neatly. So does that help answer your question? Okay. I don't know if anyone else wants to chime in. Science majors. Good science majors. Yes.
So for Chris, staying at Duke and doing research in Duke Med, do you think there's any advantage of that in helping you get into Duke Medical School? Or?
This is a question for Colin about the advantage of staying at Duke to do research in light of getting into medical school.
I think it definitely could have been an advantage if I had applied in my second, if I had taken 2 gap years. But like Camille said in the beginning, if you just take one, you're already applying kind of at the end of your senior year, your second semester, you're putting everything together, and then you submit everything in June of that summer. And so I submitted stuff before I even got into the lab. But then at interviews, I was able to talk about the research I was doing. So it helped in that respect. I think, for Duke specifically, I know of a lot of people, you probably know, Duke Medical School has a ton of Duke undergrads, and I think my class has 26. And
We have 25, 24?
24. Yeah. Out of each class is supposed to be about 100 people, so there is some selection bias, I think.
We're just that good.
Right. Maybe we're that good, but I don't know. So if Duke is where you want to go, that definitely could help you if you were taking 2 years in researching here and making contacts in the university and the medical school. But it's no guarantee, so you could definitely do just as well going somewhere else.
Oh, sure. Yeah, I mean, just to echo exactly what Colin was saying, most of all my apps were in at the time, but I think most importantly, it was nice to be able to speak about something in my interviews. And to be honest with you, I felt like most of my interviews, even at Duke, was so non-traditional. They looked at my application and they're like, oh, Joanne. That was my PI. Oh yeah, I did this and we talked about Duke basketball, so and I did not even talk, I thought I was going to talk about my research, but we ended up just talking about her and talking about how her husband wears sweatshirts, just random things that you could only get from just being around in the Duke environment and stuff like that. So I think it may make you more comfortable with being in the area and knowing the medical system for being here. It may not necessarily give you a certain leg up. I'm sure Duke just likes having people that do research. So if you do research somewhere else that's closer to your home and you're more comfortable, that's perfectly fine. I think for me it was more of just a personal level of knowing some more physicians that I could relate to with other physicians that I interviewed with.
Yes.
This is a question for Lindsay concerning her work at the Carolina Cord Blood Bank.
So, yes, that's a good point. So for me, I had done most of the opportunities that they provide there are to be able to shadow the providers on the PBMT ward, the pediatric bone marrow and transplant ward, and then working with the families closely. I had done some of that in undergrad, so I spent more of my time more in management of the interns and just doing like my daily work. But one of the nice things was, you know, as a cord blood processor, you only saw that one portion of the process of, you know, collecting the cord blood. So they gave us opportunities to go to the hospitals and work with the collectors and collecting the blood from the pregnant moms and seeing how they do the consent. So you still got a little bit of a clinical aspect in being able to do that.
Another question? Yes. This is a question for Camille and strategy behind 2 years gap year doing international work.
So, again, good question. And I think talking about logistics is really helpful. For me, so I had actually, so in terms of had I planned to do 2 years, I had done a gap year between college and, so between high school and college. And that was a really incredible formative experience. I was an exchange student in Germany. And so that kind of coming into undergrad, I was pretty certain I wanted to do a gap year. And especially the way fitting in my pre-med curriculum, as I alluded to before around my major, kind of supported that fact. Internationally, it is hard to do the application. I'm trying to think, it sort of depends on your timeline. Like I got an interview, I interviewed in Duke in January, I got an interview as late as February, and so you can't always guarantee when places will call. And so that can be kind of risky if you're like, well, I'll be here until December, and then in January I'll be gone. You know, what if the school that you really like gives you a call a week? You know, so this is what happened to me in February. Someone called me and said, hey, can you come on Monday? So let me ask my boss, but yeah, I think so. So it's a little risky to do that. But I mean, certainly possible, kind of how you play your cards, right? Yeah.
I can comment on that a little bit. I mean, I deferred, but like I mentioned, some of my friends were applying to PhD programs, and actually some were applying to med school at the same time as well. And so what they did, just sort of knowing they'd be abroad the whole year, on the applications you can indicate, you know, are you going to be out of the country at any time, and then say yes and give like a date range of like when you are planning to be in the country. And so what most of them ended up doing is sort of blocking off either sort of all in one chunk of like 2 weeks, or maybe like 1 week here, 1 week there, mostly like in the 2 week big block just to get it out of the way. They just had a bunch of interviews at once. You know, back in the U.S., I mean, that's still, like, it ended up being exhausting for some of them. I think, you know, for one of them, it was like, you know, a few different weeks. And then, I mean, it's not only the really long flight flying back to the U.S., but then all of the, you know, little flights there. So I guess that's why I was advocating for deferring a lot. But it is possible, and people do it. It's just you sort of have to know you're going into that. I mean, you know, it could work to your advantage too if you're like, oh, I have all these interviews in a row. You're like very prepared for that time, you know, versus like, you know, for me, interviewing senior year, very busy. I mentioned I was overloading, and just, you know, there's a lot going on. And so, you know, midterm interview, like, you know, it's a lot of stuff too. So you're always going to have a lot going on, but you can do it either way.
I took like the mini option of traveling, where I like when you're applying to medical school, you have like 2 periods of high activity. There's like right when you're submitting all your written essays and application stuff, and then you wait until you hear from them for interviews, and you schedule your interviews, and you do that. And those are the 2 busy periods. So what I did was I submitted everything like really early, which I would recommend anyway to anybody applying to medical school. But then I like had all that done, and then I went to Europe with my sister and backpacked for like 2 months, and then started my interviews after that, and my work at the same time. So like you can have kind of a real summer, and not go out of the country for the whole year, but get a pretty significant international experience, and then be back in time to do all your med school stuff.
I'm going to hog the microphone momentarily to ask Tassie a question. I'm really intrigued with your conversion from pre-med to PT. You indicated that it was an experience in a PT clinic that really helped you to solidify where you wanted to head. And I would just wonder what kinds of advice you would give to students who are considering PT and gap year experiences that you would recommend they engage in, and some other advice to students who might be questioning that pre-med or not position as they're heading off into their gap year.
So I had some experience with physical therapy prior to me considering that for a career. I mean, as an athlete, I had injuries, and so I'd gone through physical therapy before. I think if you're not 100% sure what you want to do, if it's physical therapy or med school or any other professional school, I think it's okay for you to explore that a little bit and volunteer. They have a lot of physical therapists, a lot of people in the healthcare field that are willing to let you come and spend some time with them. And with physical therapy, there's so many different settings. So I went to the National Rehab Hospital in Washington, D.C. I went to an outpatient clinic that was down the street from my house. There's some clinics that open early in the morning, some that are open later in the evening, so that no matter what your schedule is, there's an opportunity if that's something you really want to pursue. So I think if you're curious about something, you shouldn't hesitate to see what it's all about, because you might think that it's one thing and then you get in there and it's not exactly what you expected. So I think before you commit to going to med school, going to med school or going to physical therapy or whatever career you decide to do, I think you need to explore it first and make sure that's what you want to do before you make such a huge commitment, not just with your time, but with money too. You don't want to look back and say, I wasted years or money doing something that I was never really passionate about. And I know from when I was little, I said I wanted to be a doctor, I wanted to go to med school, and I sort of went on that path and never really stopped to think why, or should I consider something else, until I was already finished with undergrad. So if you have a curiosity about something, explore it and see if it's really where your passion is.
Thanks. I just want to echo some of the things. First of all, I was really excited to see that Tassie was representing PT on this panel, because I think sometimes at Duke, especially when we think of pre-health, we jump immediately to pre-med. I guess the one other thing I wanted to emphasize is it's okay to question. And I think that was part of, what drove me taking 2 years. So I was also looking into NP and PA programs as well. And ultimately, it was my experience as a study coordinator in Boston. I worked with a number of really fantastic NPs. I shared an office with 5 NPs. They were involved with clinical care and research. At the end of the day, I figured out I really like research, and I really like being able to ask the questions and set the research agenda, because in my role as a study coordinator, I got to participate in research and see patients and work with families, but I didn't get to do the analysis, and it turns out I really like doing figuring out how to ask the questions and how to do analysis, and an MD, especially Duke's program with research, offered more of a research degree. So that was a helpful thing to know. but I also, getting that year and that experience of talking with NPs and talking with PAs and getting to shadow them and see what they did also was helpful for me to make my decision with all of my options on the table and to kind of know, okay, yeah, I'll be in school for longer. I won't have quite as much direct patient contact. I'll be working with more patients for shorter periods of time as an MD. And so I think it's important. It's okay to question. I think that's something I just really want to emphasize. So.
Another question? Got time for a couple more? Yes. Another question for Tassie with regard to perspective on PT versus med school.
Well, I can obviously tell you a little bit about PT school. The med school contrast, I can't really speak to that. PT school for me, at least at Duke, was a 3-year program. So you went to classes through the summer. You have, while you're in school, you have 1 day, 1 week, and 12 to 20-week rotations where you get to work in a clinic. Even though you're still a student, you're still working as a therapist, but you're not getting paid to do that. And I know the first year of PT school was really challenging for me. Part of it might have been because I was out of school for a while, but the workload for the first and second semesters was really a lot. So the first year of PT school wasn't fun. In fact, the first semester was kind of miserable. I know I was really stressed out. My hair was kind of falling out a little bit. But after that, it was kind of downhill from that. And again, just being able to, along the way, have that patient interaction with patients. A lot of my classmates went to PT school directly from undergrad, and one thing that I had an advantage over them was, not saying they didn't know how to talk with people, but being able to listen to what someone else is going through and not just focusing on what, let's say, their diagnosis is, but building a relationship, building some rapport with your patient. Again, I can't really speak to how PT school would compare to med school, so I don't know if you want. Okay, so working as a physical therapist versus a physician. So depending on what state you're in, let's say you can have direct access to patients. So I don't necessarily need a referral from a physician to see a physical therapist if I'm in one state versus another state. It's required that someone sees their primary care physician. They have an issue that they feel PT can address. They send a referral for physical therapy, and then you go from there. Ultimately, PTs, yes, you have the final say in how you're caring for your patient. I think no matter what side you're on, there still needs to be collaboration between the physical therapist and with their doctor. And ultimately, you're trying to figure out what's the patient's goal. So I think no matter if you're the PT or if you're the MD, you need to be providing the patient with, or addressing the patient's specific needs and not addressing what I want to do as a therapist versus what the doctor wants, but how you can provide the patient with the best care and provide them with the optimal outcomes based on what they want.